I would say that bridge for liberalization from diseases. And we from the, to be very short, Mr. Singh, we at the US IBC, among many focuses, are laying a great support on behalf of members in the technology space. Whether any issue which is pertaining to digital technology, we stand committed. We have been working very closely with your colleagues in Neti on a variety of issues. I will not like to only focus on this, but also would like to state that all the issues relating, whether it is PDP bill, we have been very active contributors and had a very successful round of discussions recently with Ms. Meenakshi Lekhi. So with these brief words, Mr. Singh, I think we have many participants who look forward to your vision statement, and we have a very important speaker with you as for the fireside chat, and the best person to moderate, which is Suhaan, who has already introduced himself before the start of the meeting. So with these warm words, I leave it to you, Suhaan, to take over the floor and carry on with the rest of the discussions. Thank you once again. Suhaan? Aditya?
Hello.
Suhaan, you're on mute. Suhaan, you're on mute.
Yeah.
Suhaan, we can't hear you.
Yeah. Good evening, everybody here in India, and good morning to those joining in from the US.
Very good. Namaskar. Namaskar. Good morning.
I was just wondering, has Ray also joined the session as yet?
Yes, I have. Can you hear me?
Yes. Good morning, Ray.
Hi, good morning. How are you doing?
Welcome. We've got both our speakers here who joined us, one from the US and Abhishek Singh from here in India. He is the CEO of NEGD that deploys most of the e-governance work that is done by government. And I think we can't have two better people speaking to us in these times. VMware, the company that Ray works with, is actually partnering with the NHS and is a prime partner for what they've defined as the best in the world. And it would be interesting to listen to the work that you've done with the NHS. The format I would like is that both of you all make opening statements, and then we can go into an interactive round of questions. Ray, maybe I'll start with you, asking you to make your opening statement, and then Mr. Abhishek Singh thereafter, and then we can get into a round of discussions.
Sure, thank you. And thank you for the opportunity to speak to everybody. Some of you may be familiar with VMware, but probably more familiar with VMware from the point of view of what we do from things like infrastructure management and virtualization. But more and more, we have become more engaged with governments, lines of business, government agencies around application development. What is the best way to deploy those applications? And that's really the relevance and the way that we've become involved in the context of all things tied to COVID tracing and so on. Before diving into the app itself, and maybe even that's something we can talk about during the question and answer, it's probably worth just taking a bit of a step back and what are we seeing from a VMware point of view in terms of our customer base, which is basically 99% of the Fortune 1000 and beyond. It's basically all the enterprises, government agencies, and so on, as you would expect worldwide. Broadly speaking, obviously, coronavirus and the impact of it has been a little bit of a black swan event. Go back a few months, nobody expected this type of impact and so on. And what we've seen is basically four things emerging in response to this. First of all, we're seeing the initial response to, I need to now operate my business from a quarantine point of view. I need to operate my hospital, my agency from a quarantine point of view. So a lot of focus on leveraging digital technologies, remote working, the ability to ensure security and so on. But all of it focused on, I want to stay in business and continue to work even in this quarantine situation. That's the first item we saw. The second thing we see emerging is around the management of the healthcare aspects of COVID itself. Whether that's got to do with people who are using tracing apps or humans going out and doing tracing, or whether it's hospitals needing to expand, quickly understand how they manage new infrastructure, in some cases building new hospitals in order to be able to prepare for the impacts of that. So that's the second item, what I would call management and direct reaction to the COVID situation itself. The third one we're seeing, which is actually maybe the longer term, more important one, is the fact that so many companies and corporations and governments were able to flip from I've got 90% of my people on-prem to now I've got 90% of my people off-premise, working from home, working distributed. That is now viewed as one, the speed at which this has occurred has led people to realize the power of some of these digital technologies. And second of all, there's a perception it will fundamentally change how people will work and how companies will interact with their employees in the future. And that's actually the area from a VMware point of view. We've got quite a lot of emerging input coming in from our customers saying, how do I do this? How am I going to be successful in this? How do I build applications? How do I operate in this new world? Broadly speaking, we refer to that as Workplace 2.0. That is the third major effect we're seeing coming in from COVID. And the fourth one is really around what I would call an acceleration of digital transformation. Companies were already leveraging cloud. You know, when you look even at India and you speak to the CIOs of most of the large companies in India, they're already trying to make use more and more of cloud infrastructure, more and more of this distributed new type of application infrastructure. What we're seeing here is a desire to respond to that in an accelerated fashion. Partially because what they have seen is that the companies which were already heavily digitized in this fashion have proven to be more resilient as they deal with this black swan event. So from our point of view, just to kind of summarize that, four major things. Initial response, how do I deal with working remotely? Second factor, how do I deal with the disease itself, healthcare professionals? And third one, how do I deal with this new future, Workplace 2.0 emerging? And then finally, this refocus on accelerated digital transformation. That's what we're seeing right now in terms of the impact of COVID. I've obviously spoken about the technology aspect of this, but there's also a very human element to everything that we look at in terms of the response to this situation. I think that's one of the things that we all need to think of as well. Employees, customers, and so on, dealing with everything from the direct impacts of the disease itself to just having to work from home, working with families in the house, etc. All of those things we see as factors that ripple through all of this. I think they're going to be key as we think of the Workplace 2.0.
Thank you, Ray. I'd like to invite Mr. Abhishek Singh, the CEO of NEGD, to now come in and give his comments. And Mr. Singh, there's a reason why I actually changed and flipped the order of speaking is because I wanted you to actually respond to some of the points that Ray has made because and respond to it from the perspective of how the government and the public sector in India has actually been responding to first the immediate response of how do you continue and ensure continuity in governance and deal with this public crisis and pandemic, and thereafter how do you shift the way that government works to be able to respond to the needs of the citizen, as well as ensure continuity of essential services and businesses, and how have you managed to actually accelerate the digital transformation in any manner in the current time, given that you also have developed the various stacks, starting with India stack and the health stack, and whether that saw acceleration in any manner. And since you've been sitting orchestrating this as the conductor of all of this, it would be interesting to get that public sector perspective for all of us.
Thank you, Suhaan, and thank you, Ray, for the opening statement. In fact, you really put the issue in perspective, and that are the issues that we are dealing with. That are the issues that the world is dealing with, and this crisis has, in a way, unified the entire world in trying to find solutions to a common problem everyone is grappling with. So, So while the 4 issues that he identified are very true, but I would just try to give a perspective from the way we are looking at in India and the way we are looking at it from the government side of it. Of course, the contact tracing app is one of the tools which helps in supporting the healthcare workers, the frontline healthcare workers, in trying to deal with the pandemic. That's not the only solution. It requires much more than that. But yes, it does help in with this data analytics and all. And while I am at the Aarogya Setu app, I would just like to make a slight correction to what Ambika said. It has not been made by MyGov. The MyGov has one of the partners with the entire team which has developed it. The real technology of it is a classic case of government, industry, academia collaboration. And in a very short time, within a period of around 2 weeks, this app was developed, and it happened only because of this collaborative approach. Because one thing that we have learned in trying to deal with this pandemic in the last 8 weeks is that what works is innovation and collaboration. Okay, like how do we collaborate with multiple stakeholders across the spectrum, which includes people from the startups, people from industry, people from academia, and then we quickly come to solutions, and the government facilitates and provides an ecosystem in a way that necessary approvals and necessary sanctions are given to move forward very quickly. And the benefits that comes is like huge. The kind of like today we are able to predict emerging hotspots around 10 days to 2 weeks before an area becomes a hotspot. And this kind of approach with the kind of data analytics and the kind of intelligence that is going into looking at the data and looking at the emerging trends is actually saving lives. So we are able to tell the various parts, the administration in various parts of the country that this is what is going to happen. And this is where you need to take immediate precautionary steps with regard to containment or with regard to limiting the movement of people in order to ensure the prevention, the virus does not spread. So this is a huge advantage of digital technologies, and this kind of approach, the benefits that we are getting with this is like shifting away the focus from the other controversies which some people are raising, because more and more people are adopting to it. And it's really rare for a government app to get up to 110 million downloads within a period of 6 weeks. So this is what we are seeing today. The kind of digital transformation that we are seeing in this, especially with regard to healthcare, is amazing. And over and above that, there are several other ways in which technology is being used in partnership with various industries in order to ensure that we are able to do the hospital management, we are able to do essential supplies management, we are able to provide drugs, we are able to ensure that testing equipment is available across the country, the other essential commodities are maintained. And again, in enabling that, in strengthening the government's hand to face this crisis, what we have done in the last few years has really come in handy. You mentioned about the India Stack, the JAM Trinity, which we call the Aadhaar, the UID, the identity project that we did, the bank accounts that we ensured that every person has linked with a mobile number. This enabled Government of India to transfer almost $8 billion into the bank accounts of the needy in no time. So this ensured that the poor and the underprivileged who were denied of their livelihoods because of lockdown and all, they got immediate benefits. So there also technology plays a big role, because in the usual way, it would take a very long time to do that. And now building on that, as we move ahead in the times to come, what we see is that the new normal that is emerging, we feel that over a period of time, we will have to learn to live with this kind of disease. It will continue for a longer time. But then what will help us in this? Till the vaccine comes in, the only other solution seems to be behavioral change. And when we look at behavioral change, we look into various digital communication tools that we have in order to ensure that people start following the basic norms of hand washing, social distancing, using sanitizer, using masks. So we are, as part of MyGov, which is a citizen engagement platform primarily and ensures communications, two-way communications from citizens to the government and from government to the citizens, we are finding that it's becoming very effective in conveying these messages far and wide. And when we do that, especially for the app and for the communication strategies, we found that we also had the challenge of digital divide staring at us, because India has almost 500 million smartphones, but then there are another 450 million people who have phones, but they are feature phones. They do not have a broadband, they do not have the mobile internet, or they do not have the facility to download apps. So how do we address them? So for them, of course, we came up with a 192 and IVRS solution for Aarogya Setu. But then whenever we go more digital, we also have to think that it should not happen that some people are being denied. So that brings in the overall approach of ensuring digital transformation as well as addressing the issues of digital divide. Like when we look at education, for example, like e-learning became a norm. So most public schools and most schools in cities, they very quickly adopted to technology and they started using tools like Teams or Zoom to offer e-learning classes for people. But the government schools and the many of the schools in rural areas did not have this facility. So how do we address that? So for that, the plan that the government has made is to come up with a DTH platform. We already have 32 DTH channels through which we disseminate educational content, but it will require to be expanded to more such channels in multiple languages across the country so that digital learning is enabled. Another opportunity that we have in the days to come is to build up on the India stack, a health stack. So what happens is that when people cannot travel, people cannot access specialist doctors, how can we ensure that people are able to consult a doctor in an electronic manner? But there are regulatory issues involved there. So how to give a health ID, how to ensure that electronic health records are maintained in a secure manner and only the person to whom it belongs has access to it, and he allows access to anyone else whom he wants. It requires building up a framework for identity, building up a framework for registries for doctors, hospitals. It involves the framework for electronic health records, and it also requires a consent framework to ensure that we are able to keep the data secure and address privacy concerns that may arise. So, and as we go digital, similar things are required to be done in, say, agriculture. So like, how are we able to like bring together various data that we have from various sources, whether it's the soil data or the weather data or the crop history data with the land records data, and be able to give an advisories to the farmer in an integrated manner. So all this points to a digital age, which will create opportunities for everyone. So while in the short term, there are issues with regard to slowdown and with regard to businesses suffering and loss of livelihoods for many. But I think over a period of time, new opportunities will arise, and especially tech companies will have to tap into this and try to ensure how we adapt quickly in an agile manner to be able to address these requirements. Another trend that we are seeing is the future of work. Like Ray spoke about the work from home, and very quickly we found many, even government, like adopted to work from home, and many companies have adopted from home. One of the top companies in India, TCS, has said that they will be going up to 75% people working from home. So this will have huge ramifications for not only the way people work, but also on other related issues with regard to urban planning. Like what will happen to office spaces, what will happen to the where people are living, whether people will need to live in the same city where they are working or whether they can work from remotely. So it will have issues. It will have an impact on traffic. It will have an impact on pollution, which Delhi suffers from. It will have impact on climate change, and more importantly, it may lead to more women joining the workforce. So the times that we are coming, the new norm, the new normal that we are coming, will have an impact on all these dimensions, whether it is technology to tackle health challenges, whether it's technology to address communications which bring in behavioral change, whether it's bringing in technology to address health, education, agriculture, or the future of work, like how people will work in the times to come, and the e-learning part. So all these are things that are evolving, and I feel that even though we may be able to get over the pandemic in a few months, but some of these changes which we are seeing will continue to be with us, and it will require all of us to adapt to the new way of living and the new way of working. Yeah.
Thank you, Mr. Singh. I'd just like to respond to you with one of the points that you raised right at the beginning, that what you felt was the success of the Aarogya Setu endeavor was the collaboration between government, industry, and academia. And I would like to ask you whether the government is actually looking at creating such models of participation, and how does that become far more open and more participatory? Because very often the allegations come in that these type of collaborative models are only for the chosen few, and it's important to be able to ensure that there is a level playing field with all of those that have the necessary skill. On the flip side, there is the difficulty of choosing and creating standards and making those technology choices and on how to exclude certain people and how to choose certain people. And could you give some insight into how you all went about that and how do you plan to go about this collaborative model going forward?
See, what we normally do is that like this crisis was something like when we started with this, we immediately, to deal with the crisis, we had launched an innovation challenge on the MyGov platform. So it was like a hackathon in which we asked companies, startups, and all to suggest solutions with regard to in what ways we can deal with the solution. So, so lot of contact tracing, because already Trace Together from Singapore was in news. So a lot of companies suggested their solutions with which can be worked on by the government for handling this issue. So again, based on whatever suggestions came, there was a process by which the algorithms and the approach to the contact tracing approach was examined by a high-level committee, and that's how it was chosen. And that is the way one plans to go ahead. And midway during the campaign, when we were working from home and using various collaboration tools, so there were some issues with raised regard to one of the VC solutions, namely Zoom, about security issues, and Zoom came up with some clarifications also. And later on, the government advised us not to use it for VC meetings. So then immediately the thought came, okay, why don't we tap into our expertise that exists within the country, the innovation that exists in the startups and all. And we immediately launched a VC solution challenge, or video conferencing solution challenge. And we initially thought that we'll select 10 companies and they will give them some financial support for building prototypes. And then we'll ask to select final 3 and then give them some support for building a final solution. We were amazed to get 2,000 entries for that contest. And a lot of them already had some kind of prototypes. So now we are in the process of finalizing that and selecting a solution that will be used by Government of India as well as the other state governments. So what this experience for the VC Solution Challenge lets us know is that there is a lot of potential lying in our startup ecosystem, in our companies, IT companies, and only thing is that we need to give them an opportunity to develop their solutions, ensure that government becomes one of the users of their systems, pay them for their services, and help them in building up on whatever they have built and offering these services to Indian industry, to the world, and build products of world class. So that is what we are planning to do in the days to come.
So so there'll be a shift from the traditional procurement model that we've seen right now, or?
There will be a mix. It's too early to say whether there will be a shift, but there will be a mix. So depending on where we need to encourage, because very often government procurement models works on gives an opportunity to only established players, people who have experience, people who have certain amount of turnover, and very often startups and all, and people who have brilliant ideas and potential to build products for future. They unfortunately they do not get preference in that model. So what we are trying to do is that since the potential exists and there are a lot of companies who are trying to build products which can be world class and which can provide solutions to similar problems being faced by the world, if the government encourages them, provides them the necessary support, these kind of products will help us, all of us, in the days to come.
Okay, thank you. Ray, I'd like to bring you in over here and ask you about the experience that you had in this public-private partnership with the NHS. And I understand from the publicly available information that the model that was utilized in the UK was that of a centralized model, but there is also talk of shifting into a more decentralized architecture. And I'd like you to give us some insight into the modeling, the architecture, and the method of partnership, as well as the standards framework that you'll utilize for this, because given that the world will face pandemics and we're going to see the interoperability maybe at some point of various technologies, how do you see the standard setting happen in this place, given the fact that in the UK as well, there's anonymization of data, which is then going to be utilized for research like we're going to be doing in India. And I'd like your experience to be shared with everybody who's on the call here.
Okay. There's a lot of questions in there.
Yes, it is. But I just wanted to give you something meaty to chew on. Yeah.
First of all, let me echo what Abhishek indicated about the need for partnership. In the end, most of us from the technology side of the world, we know security, we know how to do communication, we know how to scale and build applications. But in this particular case, you're dealing with a challenge which is deeply interconnected. Yeah, and you heard from Mr. Singh speak about even how the impacts will relate to things like how will we get more people into the workforce who might not have come into the workforce in the past, right? When you think about all that interconnectedness, you get into a need for partnership with a whole bunch of experts. So in the particular case where we look at our involvement with some of the COVID tracing applications, that involves first and foremost the healthcare professionals, the public healthcare professionals, epidemiologists, and the data scientists looking at what is the problem we need to solve. We need to make sure that we're able to solve this concept of contact tracing, a well-known technique in terms of how you deal with the epidemiology of diseases such as COVID, but we want to make that more efficient and speedier than ever before. How can I leverage technology to do that? And the other context that you need to think through is you're also dealing with a political and a community and a cultural problem. People are nervous about privacy. We need to put that first and foremost. People are nervous about, what will this have some impact on my job? Will I be able to go to work if I click this button and says that I'm somehow affected by coronavirus and so on? All of those are very human problems. So the bottom line is, even as a technology company, our focus has been on partnership. And we have not necessarily, in the various apps that we've built, typically gone in and say, here's an app, please use it. Instead, we've gone in and said, we have worked with you many times before. Let's partner and figure out what is important to you and how we can build this app with you. And that was the approach that we've had with the NHSX. We're leveraging a part of VMware called Pivotal Labs, and Pivotal Labs has a very strong partnership relationship with its customers. It essentially does not go in and say, let me be a contractor and build this for you. Instead, it goes in and says, let me work with you. Let me make sure that your people are involved in these projects. And that has been very much the case with NHSX. So when you speak of VMware being the developer or being the prime, it has been in deep relationship with developers from NHSX, from their partners, from the people who build the devices. All of that has been the case. To some of the specific nature of what has been going on there, I'm only going to speak of what is public at this point, and much of this is already available on everything from the BBC to the Financial Times and so on. Right now, this project is in effectively a soft release. I would describe it as that within the Isle of Wight in the UK, and it is actively being evaluated. It is actively, you've got I think somewhere in the order of 70,000 users at this stage. Geographically within the Isle of Wight, effectively using the app, and everything is being trying to understood about how that works, down to really nuts and bolts. This is a low energy Bluetooth tracking app. So basically it tries to detect when one phone is close to another phone. It anonymizes all of that in terms of who the people are, any of the data that is fed back into the system, a huge focus on making that anonymous. But you actually get into nuts and bolts of how does Bluetooth actually work within homes, within offices, within buildings. So you have one extreme, a very technical problem. Then you get into, as you actually build this data in a highly anonymous fashion, how do you meet the needs of the epidemiologists? The strongest message we have been getting from the epidemiologists is the desire to build a true contact tracing web. So if I say I am infected, or if a test indicates I have the disease in some way, they would like to very quickly be able to go out and say to all of the people I've been in contact with, please isolate right now, or at least let's have a conversation to figure out, are you seeing any symptoms and so on. And speed is a key and important part of that, the ability to quickly get to that in that way. That's what drove this, these questions between centralized and decentralized approaches. From a VMware point of view, we are building apps in the context of both centralized and decentralized. It's a technology question to us. The decision of how to use these really resides with the healthcare authorities that are using these applications. If people are not familiar with the core differences on this, and I'm probably I'm probably giving just a very high-level view of this. Essentially, the question there is, where is the decision made as to how the next level of infection from the first person is alerted? In centralized, that's typically done by the healthcare system itself. Data goes back to it. They know in an anonymous fashion, here's a bunch of IDs of people who've been close to this person. Let's alert them now. But they know the number. They know it's 50 people. They know when those 50, or they know how long those 50 people potentially were in contact with the person that was infected. The decentralized model instead distributes that out to all of the phones themselves, and the phones can turn around and simply say, I recognize that this ID is the ID of somebody who was infected. Now I will alert the people who has this ID on their phone. So the decision is made in the distributed network itself. But to be clear, in both cases, you do need to have the device. You do need to be able to register people with the app. You do need to be able to know that somebody is able to say, I've actually got the disease, and make that visible back into the healthcare system. What you're really looking at is what is the degree of hardcore epidemiology and tracing I can bring to bear across those different types of approaches. The one point I would make is the centralized and decentralized question, if you look at what's going on in the press and so on, has been blended with the Bluetooth question. What is the ability to run Bluetooth in the background and so on? The solutions we have built do run Bluetooth, low energy Bluetooth, the ability to do that in the background on the devices. And we look at that as a separate decision, as away from the decision of centralized versus decentralized. What is interesting though is, and I think Mr. Singh also referred to this, you must get a large number of people using the application if this is to be effective. And so one of the things you need to recognize, again, as Mr. Singh referred to, is you don't have a monolithic community out there. Not everybody has one phone of a certain version of a particular operating system. And so you need to make sure as you can build these apps, you can get the broadest coverage across all of the available phones that are out there. Different versions of Android, different versions of iOS, et cetera, and be able to support as many of those as possible. Sorry, you had a whole bunch of questions in there. I'm not sure I've answered them all.
The question I'd ask is, when you are choosing this centralized and decentralized model, and I'll come to you, Mr. Singh, as well on the same point, is how do you plan for security? How do you plan for privacy frameworks, legal liabilities, and things like that? Because on the Indian app, we've gone into a framework where there is no there is not going to be a liability framework that's going to be taken by the government. This is got their mic unmuted. Yeah. There is no liability that's going to fall on anyone if something goes wrong, given the current framework that's there in the terms of service. So how have you dealt with that in the UK? And sir, Mr. Singh, I'll come back to you on asking about the standard setting, security, as well as data protection frameworks and obligations under law, and how you plan for that. So Ray, if you could go first on that.
Yeah, so I'm certainly not an expert on the legal side of liability and so on. But what I can say is that the application and the how can I put it, the people who are driving, leveraging the data and so on are the national healthcare system of the US. It is, or sorry, of the UK. It is not a private company saying, I'm gathering this data and then doing something with it. It is the NHS. It is the NHS. And so because of that, when you actually think about what they already do in terms of managing IDs, in terms of managing the healthcare systems and so on, much of this data, or this type of data, they are already dealing with and using every single day. So from that point of view, this is a decision made by, and how this is managed is a decision made by our customers, and those customers are typically the healthcare systems or national governments or state governments of a particular organization, and they are the ones then that understand and manage the legal side of this.
Thank you. Mr. Singh, would you like to respond?
See, it's not correct to say that there is no liability. The entire privacy policy and the framework under which the app functions has been given very clearly, and it has been given legal framework. Though we do not have a Data Privacy Act as of now, but the draft Data Privacy Act, all the provisions which are there in the Data Privacy Act have been built up into the data sharing and data access and knowledge sharing protocol, which was issued, and that was issued under the Disaster Management Act. So it does give obligation on everyone who has access to the data, and as per the framework, access to the data is only with regard to health authorities, and that also anonymized data with regard to only to the limited to the extent of giving medical help and medical interventions. So the framework exists, the guidelines are very clear, and the policy, when the app registers people, it takes informed consent. It explains in several screens with regard to what the app does, what is the functionality, when does the data of a user goes to the server, and after that only we register anyone. And if you look into the overall statistics that we have so far, out of the 110 million downloads that we have almost, out of that, only data of around 22,000 COVID positive users have gone to the server. So that is a 0.02% of all of the total users. For the rest of the users, the entire data remains on their handsets and they're on their phones and doesn't go anywhere. So this has been repeatedly emphasized, and this also is taken only for contact tracing. And as Ray was saying, if we leave it to the doctors and to the hospitals, they would like to do anything and everything possible to control this virus. So the technological tool is there, but that's not the only solution that is there. The other measures, health interventions are there. And while the Aarogya Setu app does help in contact tracing, but it doesn't help us in letting know whether the person who came in contact was having a mask, or how far it was, or whether there was any real contact or not. So those issues will remain. So what we are finding is that when we do testing of the people who have shown up in the Bluetooth contacts, when we test people, we get a positive COVID-19 percentage of almost 24%, which is very high compared to the overall testing that we are doing. We have done almost 2.2 million testing, out of which around 100,000 positive cases are there. So in the overall testing, the random testing that's happening on with people with symptoms and otherwise, the percentages of positive is less than 3%. But when we do the testing of people who have come in the Bluetooth contacts, there the positive percentage is coming to be 24%. So this is a proof that we are able to focus on the really vulnerable sections of people. We are able to optimize the usage of testing equipment, the healthcare personnel, and ensure that we are able to detect cases faster and contain them. So that's a huge advantage when it comes to using such data and such tools and such products for helping control this pandemic.
Thank you, Mr. Singh. Yeah, go. Yes.
Sorry, one comment I would add there, in that any of the apps I have seen have focused heavily on driving a very anonymous approach to how the data is being handled. And second of all, there's a huge focus for the most part, and I particularly see this even on the NHSX, around transparency, making the code open source, trying to be as transparent as possible around architectures and how those architectures are used and so on, to allow the experts and those with concerns to actually weigh in and be able to get this good balance between, I'm trying to solve a real problem. We are trying to solve the problem of how do I manage this disease, and how do I manage this disease and at the same time get the economy back working. And then you're trying to balance that against these security concerns and so on. One of the key aspects of that is transparency, allowing the experts to see what's going on weigh in and taking their advice and so on as needed to be able to say we can make this stronger and better. But you cannot lose sight of the fact is you've got a goal, and that goal is to save lives and to do so by getting the economy back and running as well. So you can get that balance just right.
Thank you. We'll open up to.
I fully, just a minute, Suhaan. I fully agree to what Ray said, and we are also working on, and we are committed to making the code in open source. And what is required is that, as you will understand, this code was developed in very short time. But when we make it open source, we want to do proper documentation and proper explanation, because the moment it goes in the open source, there will be all kinds of experts from world over who will be giving us inputs with regard to what we are doing. So we need to equip ourselves to be able to handle that surge is there. The technical team is anyway overstretched in handling the pressure that is there with the increasing number of downloads which are happening. We have the app on iOS, we have the app on Android, and we also launched the app on the KaiOS platform, on which around 110 million Geo phones work in India. So it's like managing 3 platforms, ensuring that the app is updated, ensuring that the correct information goes, and at the same time working on the documentation documentation part of the entire code to when we make it open source. But we are committed to doing that, and very soon the code will be in open source. So we are committed to transparency. We are committed to ensuring that the app does only what it's promised to do.
Thank you, Mr. Singh. We'll open it up for questions now. And I know that Dr. Rai had raised his hand earlier to intervene on a comment. Dr. Rai, if you would like to come in now.
Dr. Rai.
Suhaan, I'm sorry, I didn't raise the hand for asking question or intervening in between there. My hand, it went up by mistake to show that I had joined the meeting, nothing beyond that. And I really don't want to complicate the issue by adding any security or something up and down here and there. I think this is a different time, and we should all collectively find a solution and collectively support the government. And I know Abhishek very well. We have a long association of years together, more than a decade, and I have full faith in his leadership and Mr. Sahani's leadership also. Well, there is no framework, as you said, Suhaan, and Abhishek said that there is a draft. Draft is a draft, but at the end of the day, there is a Supreme Court judgment, Puttauswamy judgment, and things will be seen as per the Puttauswamy judgment. This is the first experience, and this pandemic, as I said other day in the US IBC things there, the concept of privacy certainly will go a bit of underchange there. It will not be the same as what we have been thinking and listening about it. At least today we are in a different emotions. It will amount to be, or maybe after 6 months, if the situation gets used to, or we get used to situation or changes, we may end up in a different kind of a thinking. But as it appears, privacy may undergo different kind of a thing. See, the whole onus is on the government that they kind of a form, or they formulate and they implement its standards within themselves there. There is no way we can check it there. You see, I am aware of the case, and I have dealt this case in detail with the Kerala case. If you see that Kerala case, there I've seen that case also. There is no, I mean, it's going to be very, very difficult, particularly, and if we raise this issue, anonymization or all kind of a things, it's going to be very, very difficult there. And certainly when the privacy bill gets implemented, there will be many problems will be there when we write the rules. It will be more tedious, more troublesome than the main act itself there. So I think we can only request the government, and government is aware of it, and we can urge the government to follow to make their own SOPs inside at least, and follow those SOPs strictly, that the data is not shared like that. And I must remind Suhaan there, that as per the draft bill which Mr. Abhishek Singh has said it, the health data will fall under the critical data. The way, I mean, I was a member of the expert committee, and the health data, where the concerned section 34, 33, 34 of the bill has been formed. And there is a provision in that section, cross-border flow of information. There is a provision, health data, special permission of the DPA is there. So my gut feeling is that it will somehow will fall under the critical data. So I only urge that they must, and they would have, I'm sure they would have, a SOPs, how the data will be held, how the data will be transferred, and how the data will be processed. There should be a, after seeing the Kerala's case, there should be a proper record and documentation. They make it. I think they themselves will get accountable. Once they make, they decide to put, and they, I'm sure they will have a documentation. But if they make the proper record, anyone who's maintaining record, he's very, very cautious of the other, so many other factors there. At this point of a time, SOP and the proper documentation need to be maintained. As far as anonymization is concerned, there are very gray areas. How to do that? What formula? I mean, there are no standards are informed. So it all depends upon. I'm sure the government is very serious about privacy, and they are the government which brought out this bill. They will form the SOP is important, framing their own internal process and strictly following the process and keeping audit is important. Thank you.
Thank you, Dr. Rai, and your experience as being our National Cybersecurity Chief would obviously give your perspective some degree of uniqueness. I'll move on to the next question. I think Saurabh Mohanty has a question for our panelists.
Hey, hi, Suhaan. Thanks for that.
Hi.
Am I audible?
Yes, you are.
Okay,
Go
fantastic.
ahead.
Okay, so my question is in line with the legal liability, which is the talk that is going on. So considering the health data, which is a personal sensitive data as per the IT Act 2000. So currently, I understand we are taking the consent from the customer while somebody is downloading the Aarogya Setu app. However, when the data is being shared with the concerned health officials or anybody who has access to this personal sensitive data, is there a legal liability which has been provisioned in terms of building the accountability of the recipient's end? That is one. Second thing is that what if there will be legal liability arises where there is a case of data leakage somebody claims, okay, through this app? Do we have a provision to trace it back that whether it has been leaked through this channel so that we can take the countermeasure, or what is the other provision to detect that, okay, there is a leakage from this app? How do you address that?
Mr. Singh?
Yeah. So as I mentioned, the liability with the Data Access and Knowledge Sharing Protocol says that each and everyone who gets access to the data from the source of the data, like the custodian of the data is NIC, which is the government's technical arm, which is leading the effort for developing and maintaining the application. And they are the custodians of the entire data. And from there, only the data with regard to those users who need to be quarantined, who need to be tested, this kind of information flows from them to the concerned health authorities in the states and the districts. So the entire liability is also passed on to every person who has access to such data. And if anybody is found misusing it or found responsible for any leakage of data of any kind, he will have the same liability as what NIC will have. And since the framework has been issued in the Disaster Management Act prescribes various kinds of punishments for various kinds of offenses. So the legal liability clause is being ensured through the Disaster Management Act, which has been invoked and under which the Data Sharing and Data Access and Knowledge Sharing Protocol has been issued. So that is how it is. So one should rest assured that the software there will be an audit trail, and if there's any data which is leaking from any source, that will be known. People who have access to data, they access it through secure passwords and through secure access. So those protocols are very clearly defined. So any deliberate or even inadvertent data leak can be detected.
Thank you, Mr. Singh. So I'll ask one last question, and then I'll invite Jay to give his closing remarks. And I'm looking at the post-pandemic situation because, I mean, given that we are the US IBC, the US India Business Council, I presume that we also want to all start traveling between the two countries and travel internationally. And I was wondering whether there is thinking going on the scenario post the immediate crisis where we start opening up international travel, and then are there frameworks for interoperability that are being thought of either by Ray, you and your team working with your consortium, Mr. Singh over here? Do we need to start looking at international cybersecurity frameworks, like the NIST framework and other frameworks, or common frameworks on anonymization? Is this going to create a situation that we actually need truly global standards that are common across these countries? Because given that this app is going to be so fundamental to everyday life just for this disease, and many of governments are thinking of making this a cornerstone for healthcare interventions going forward, and given that it's sensitive information, how do we deal with this in an international context when travel resumes and we try and get back to more normal life?
Will I jump in here, Abhishek?
Yeah, Ray, go ahead.
Okay. Like you said, I mean, there's a very strong desire to get back to, quote, normal life. But I think the normal life might be a little bit different than what we've been used to. As I've said earlier, I think, you're going to find that most organizations are going to be highly distributed and are going to be able to, and because of that, are going to make more and more use of collaboration tools and so on, as maybe you see less in-person meetings, etc. But broadly speaking, obviously, we all want to get back to international travel, both from a business point of view and from a personal point of view. Right at this point, we have had various conversations where government agencies from different parts of the world and so on have began to ask the question of interoperability. And this is only beginning, frankly, because at this point, I think most people have been focused on how do I solve this problem for my community, for my country, for the people that, for the healthcare systems that I am in charge, responsible for. But we are beginning to see questions on interoperability, and I think there is an opportunity there to be able to do something around interoperability for tracing and how data would be shared in some very secure fashion. I am not aware of a formal approach to making that happen at this point. I think it's only beginning to be seen as an issue. You mentioned frameworks and various things in the mix around the security, and you mentioned NIST, which is obviously very US focused. As far as I'm aware, they have not really spoken on this item at this point around the interoperability of these tracing type of apps. But we have found to our experience, for instance, as we look at things in the past like IoT devices and so on, the NIST frameworks have been very valuable to say, okay, this is something I can use as a basis to be able to build my security paradigms on. So, that is something that, we'd be interested in seeing more formalization of those frameworks, and we're beginning to see those questions asked right now, particularly as countries begin to say, how am I going to deal with, somebody traveling internationally with this disease?
Mr. Singh, is the government thinking about interoperability and handshakes with other apps and eventual travel and framework of standards that are international?
Yeah, we do conform to all international standards, and if you look at the National Digital Blue Health Print, which has been come out, it conforms to all the, when relating to health, it conforms to all the standards, WHO standards with regard to drugs, with regard to various kinds of things that you deal with in the realm of health. Because ultimately, when you're going to EHR, electronic health records, the records have to conform to the global standards, international standards. And the overall framework that we have in India, whether it's the UIT project or whether it's the UPI, which is again another classic example which has transformed the payments in India. That's all is based on an interoperable framework. So or even if the DigiLocker that we see in, which is a secure repository of documents that we have built up in India. So ultimately, when we build any stack over the strengths of the building blocks of the UID or the UPI or the DigiLocker or the e-consent framework, it will have to be interoperable because we need to talk to systems across the spectrum in India as well as anywhere else. So for example, when the health stack is built up and the interoperable switch is there, so it will allow anyone to choose any health service provider in the government or the private domain. It will allow them to pay through a UPI interface. It will allow API level integration with the insurance companies so that it all becomes one complete whole. So
can I just intervene Mr. Singh, on this? How do you plan to evolve those standards? Is it going to be a participatory model that industry can also participate in?
Yes, what the standard the standard protocol, the SOP for laying down standards in any domain is that initial level consultations are done with the industry, then draft standards are prepared,
yes,
and then draft standards are published on a government portal, and then comments are invited from all stakeholders. Then those comments are then synthesized, then if required, a consultation is held in which people actually come and give their views. And then there is a group of experts, which includes industry representatives, which helps in finalizing the standards. So it's a very consultative process, and it ensures that it's fair, it's equitable, and it addresses concerns of all sections of the industry.
So NEGD will be leading that?
Depends. For example, health. We will provide the support, but we would ideally want health to lead it. Ultimately, we have the National Health Authority, which is running the Ayushman Bharat program, which is one of the largest health insurance programs across the world. So we ideally like the National Health Authority of India to run it. We will provide them the necessary technical support.
All right, thank you. There's one last quick question, which is a bit interesting. That's why I thought I'd bring it up. Sachin Saini asked the question if you could share the details on how the IVR system with people without smartphones is working. And the related comment on that is most plants don't allow mobiles on the shop floor. So the interaction between different workers on that may be very difficult to capture. And what is the government's thinking around that?
See, the first part of the question, like the 1921 Aarogya Setu IVRS line, what it does is that it works, it doesn't do contact tracing in the true sense, like the Aarogya Setu app does, but it's primarily a symptom checker in which anyone with a basic phone, within a feature phone, can give a missed call on 1921, and then he gets a call back from us, which will ask them the same questions which are there on the symptom checker to assess the level of health, and then then this data is processed, and those who indicate symptoms on the 1921 IVRS line, they get a further call back from the National Health Authority, in which depending on the symptoms, the doctors speak to them and then counsel them with regard to what they should do, whether it's just a caution in which they should take care, or whether they need to quarantine themselves, or whether they need to go for testing. And those serious cases where symptoms are serious are also referred to the local health authorities so that they can intervene and provide the necessary medical help. So that is how the 1921 IVRS system works. With regard to the other question with regard to phones not being allowed on the shop floors, so these are challenges that we will come in. So every industry or every company which would, because people want to function also. We can't have a lockdown forever, because it's not only a question of life, it's a question of livelihoods also. So when we do that, when you start functioning, then you will have to think of what are the measures that we are following. Like if you can't allow phones on the shop floor, then at least when they are coming in, when they are joining work at that point of time, their status can be seen, their temperature can be monitored, basic masks and social distancing norms can be given, and then they can be allowed to work. Because we also know that though we are asking people to download, and 110 million people have downloaded, but there might be people who would switch off their Bluetooth. There might be people who will uninstall the app. There might be people whose batteries will die down. So technology has a solution, but it's not a foolproof solution. But to some extent, it does help in mitigating the problem that we have, and reduces the burden and reduces the stress on the health infrastructure.
Great. Thank you, Mr. Singh. Thank you, Ray. It was great engaging with you. Jay, I'll hand it over to you to give your closing remarks.
Okay. Well, wonderful. First and foremost, gentlemen, what a fabulous conversation. Just the quality of the engagement, the information shared, the platform in this format, I think is really valuable. It highlights the benefits of a public-private partnership and bringing our members to actually have a real conversation with the government, share solutions and international best practices. Ray, I really want to thank you for getting up so early in the morning. I don't know if everybody knows it's the West Coast there, so it's only 7 a.m. So having you part of this discourse was really useful, hearing about everything you're doing internationally and how VMware is engaging in not only the technology, but the political and cultural context of privacy and digital health. That was really valuable to me, and I appreciate it, and I assume our members as well. Mr. Singh, we really appreciate your openness to have these sorts of conversations. We'd invite you to have others. We can come with you with ideas or vice versa. It's really about collaboration between public, private, industry and government and individuals. We all want to focus on getting behind the health crisis so we could really start to think about the economics of all of that. One of the themes that everybody mentioned, and Suhaan, I really want to thank you for bringing this conversation together in such an articulate way. But one of the core themes was how we move forward, going forward. I'd be remiss if I did not advertise that the next USIBC Digital Economy event is next week, roughly the same time, and it's the future of work. And we have senior executives from Eightfold AI, GE, HCL, and we have the CEO of Invest India, Deepak Bagla. So we hope everybody can join that conversation as well. As a final note, this topic of digital health is something that's increasingly important amongst our members, but also critical to both of our societies. But perhaps the most important thing, it represents an opportunities for the two countries to find some common ground and really crisscross two critical areas of our engagement, both the digital and the healthcare. So we hope to do more with that. And so as a final note, I'd just like to thank our members for joining both early and late, and appreciate everybody's time and attention. And please do not hesitate to reach out to us where and when we could help. Enjoy your day, and please everybody do stay safe. Bye for now.
Thank you.
Thank you.
Thank you, Ray.
everybody.
Thank you, Mr. Singh.
Thank
you,
you.
Suhaan.
Thank you.
Thank you,
Thanks a
Mr.
lot.
Singh.
Thanks a lot. Thank you.